Welcome to today's UNM Healthcast. I'm Elizabeth Dwyer-Sandlin, and today we're talking with Dr. Dehority, who is the Associate Professor of Pediatric Infectious Diseases at the UNM School of Medicine. Thanks so much for being with us today, Dr. Dehority.
Yeah, it's my pleasure.
So tell us a little bit about who you are and the work that you do, just to kick us off.
Take care of children that have infections at the School of Medicine very broadly. And from a research perspective, I do a fair amount of research on vaccines, and that currently involves helping to run the study of the Moderna COVID vaccine in children at UNM. We're also studying vaccine hesitancy in parents, and that is investigating the belief systems and concerns that parents have about vaccines for their children. And we've also studied how the media and movies portray immunizations, and looking at negative and positive portrayals in the cinema of vaccines.
Well, that's a really fascinating piece of your work that I didn't know existed. I'm a screenwriter, so I have a particularly vested interest in how media affects culture and take that responsibility very seriously. So I think it's really cool that you do that work. Can you tell us a little bit about the COVID vaccines specifically and how those work and which ones are available for kids? We'll just get some broad stroke bullet points to kick us off.
The COVID vaccination for kids is what we call a messenger RNA vaccine. Messenger RNA is like a blueprint that an architect might use to build a house. What researchers did was took a little piece of the virus that causes COVID, not the entire thing, but a piece. That would be the equivalent to an architect taking, say, just the roof of a house and then using the blueprints for that little piece. That little piece of the blueprints is what's being injected into the body. In the body, it leads to the production of that one piece of the virus, say the roof. And then the body's immune system practices recognizing and attacking that one piece. So that down the road, if a child gets infected and gets infected with this virus that causes COVID, their immune system is already primed, practiced, and ready to go, so they can basically kick the COVID out of the body before it even establishes an infection.
And which COVID vaccines?
For kids, right now it's the Pfizer vaccine.
Pfizer.
There are two vaccines that use messenger RNA, Moderna and Pfizer. Moderna, from a regulatory standpoint, lagging a little behind Pfizer with some of the approvals for children. So right now, Pfizer is the pediatric COVID vaccine option.
And is it accurate that children generally get a milder version of COVID? And if so, why is it still important to get them vaccinated?
Yes and no. It is true that children don't get as sick as older people, and we learned that early on. So the older you are, the more likely you are to have a severe outcome and die. However, we are increasingly appreciating that kids actually get sicker than we initially thought with COVID. Early on in the pandemic, kids were sheltering at home. They were kept out of school the whole year. They were wearing face masks. They weren't participating in sports and after-school activities. They really weren't getting a lot of COVID. And then two things happened. One, we had the Delta variant start to emerge, which was new. And then kids started going back to school and participating in their activities. As that happened, we saw an uptick in the number of pediatric cases and increasing reports of more severe cases, including deaths. So it is still true that kids don't get as sick as older people, but they still get very sick. And I would classify this disease as more serious than the flu.
More serious than the flu. Okay, that is definitely important information to have. So this started out with vaccines being available for just adults, then children age 12 and older, and now we're working with the 5 to 11 age group. Are they receiving the same vaccine that's given to children 12 and older or adults?
Yeah, they're receiving the same vaccine, but the dose is decreased. So it's really the same concept as, say, an antibiotic. If you develop strep throat, you'll be given an antibiotic called penicillin by your doctor. Your child, if they get strep throat, will get the exact same antibiotic, but because they're littler, they'll have a slightly smaller dose. So both the Pfizer and the Moderna vaccines are using the same product. They've just decreased the dose for those younger children. The teenagers, however, 12 and above, are getting an adult dose.
Okay, yeah, that makes sense. So it's size-based. Are there any additional risks for children getting the vaccine compared to, say, adults or adolescents?
Not that we know of. And with the adolescents, for sure, we didn't see anything different than we saw with adults. We are still generating data, particularly on some of those younger children, but the preliminary data we have on 5 to 11-year-olds indicates this vaccine is very safe and there are no red flags we've seen whatsoever.
So, what are some of the, let's talk a little bit about the risks just so parents are aware. Are there anything, is there anything, are there any side effects or things that parents should be conscious of while they're preparing their child to get a vaccine?
There's two main things I would mention. One, there's the traditional side effects you could see with any vaccine. So it's going to hurt when the needle enters the arm. It's a shot, or as we say in pediatrics, a pokey pokey or an owie. So it's going to hurt. There might be a little bit of redness at the site. Again, that's kind of normal. You could get a little rash at the site. You can see that with any shot. The one thing that's a little more pronounced with these messenger RNA vaccines, and if you're an adult that's had this, you may know this, is particularly after that second shot, you may feel a little sick and tired, may even have some fevers in the first day or so. That's actually a good thing. That actually means your immune system is working. Those fevers and that fatigue is the drain on your body as the immune system ramps up, practices, and generates all those antibodies to protect you when you actually see COVID. And I always tell families, if this happens to you or your child, rest assured it's way better than getting COVID. And all that's doing is preparing your immune system for the day that you might actually see COVID. It's the equivalent to staying up all night to prepare for a test. You might feel a little tired the next day, but you're going to ace your test.
Fantastic. Yeah, my 7-year-old just got her first shot and she did get a little bit of a rash at the injection site. And so I told her we would, she should sleep on it and we'd see how it looked in the morning. And she woke up feeling right as rain and said, sleeping on it was the right thing to do.
My children had almost the exact same experience. Yeah.
So how would you recommend that parents prepare their kids for the vaccine, physically and psychologically? Like what kind of conversations can they have? Can they give them Tylenol or anything to help with that owie pain, or what would you recommend?
That's a good question. I think one of the things we often don't take into consideration as much as we should, particularly with the younger kids, is that the whole idea of COVID is probably scarier for them than we think. They've been in the background in the living room and the TV is on, hearing parents talk about things, seeing their parents working from home for the first time. They were kept out of school all last year from this COVID. They may not be old enough to understand all of that. And so if you tell them we're going to get a COVID shot, that may be frightening for them. So I think explaining, as we did earlier, what this shot is really important. You'd say, remember how we took you for your shots when you were younger to protect you from things like chickenpox and the flu? This is the same thing for COVID. We don't want you to get this COVID you've heard so much about. And this shot is going to prevent you, hopefully, from getting COVID. It's not going to give you COVID. This is to help you so that you don't get COVID. If parents have been vaccinated, I would bring that up. It's a great time. Say, mom had this or dad had this, and now you're going to get it. Or older brother had it, and now it's your turn to get it. Point out that other people in the family, friends and relatives went through the same experience. I think that's one of the most important things. In terms of some of the pain that they might get, you can give ibuprofen or Motrin or Advil or Tylenol before or after. It's not going to impact the shot in any way, but you don't have to. You're free to get the shot and then wait to give that if there's a problem afterwards.
That makes a lot of sense. So it seems like kids and adults, they might have heard a lot of myths floating around about the vaccine and common misconceptions that we hear about the vaccine. Can you tell me a little bit about the research that's gone into this and how and why it's safe for our children?
Yeah, it's interesting because this is becoming one of the more well-studied vaccines in modern memory. Last I looked, I think about 6 billion people had received a COVID vaccine.
Wow.
And we're looking at maybe 70,000 people that have been enrolled in clinical trials of this vaccine. By comparison, the first big trial for the measles vaccine in the 1960s enrolled 36,000 people. So we have a really large amount of data on this vaccine. And so while it is true, it's still somewhat experimental because it's only been out for about a year. Because of the nature of this pandemic and how widely we've used it in that first year, we also have a ton of information on this, all of which is reassuring. We're not seeing anything concerning about this. The internet can be, and social media can be rife with good information and bad information. And it seems that for every piece of good information that's useful and fact checked, you have a competing claim that is not, and is actually misinformation or at worst disinformation. And so I think it's helpful to stick with trusted sites, the CDC, the NIH, the World Health Organization, and perhaps most importantly, your medical provider that can provide you with some of that information. Some of the myths that I think are probably most prevalent are that this is, number one, this was rushed into production because of the pandemic. They've cut corners. There's this new experimental technology, and they just rushed it into production like some sort of science fiction movie. The technology for that messenger RNA actually has been around for about 30 years, and they've been studying these vaccines in humans for over a decade. So while it's true this is the widest use that we've ever had, the technology is not new and it's not experimental. Also, one reason this was rushed into production, or seemingly rushed into production, was messenger RNA vaccines are easier and quicker to make. So we didn't have to wait as long as we would have with a traditional vaccine. We might have to actually grow up in a lab on culture. We were able to use genetic sequencing and mass produce this. And so that's why it seemed like this vaccine came out too quickly. It actually didn't, and it speaks to the power of that new technology. Another big myth that I hear a lot is that it can sterilize you. I don't even know where that came from. That's not true completely. Some people are also concerned that because you're injecting that blueprint, you're going to inject the virus, that it can create the virus. But as we mentioned before, they're just injecting a tiny piece. So the blueprints for the roof of a house, it cannot create an actual virus. And so the take-home message is this is a very safe and effective way to prevent a very, very dangerous and frightening disease.
So to that point, I would love to hear a little bit about, one of the pieces of, I would say, misinformation out there. There tends to be a lot of like, well, it doesn't necessarily keep you from getting COVID. So why is it important, even if you can have a breakthrough case of COVID, even after getting the vaccine? One might think of the flu and as it was a pandemic, but then became a part of our lives, and getting the flu vaccine doesn't guarantee you won't get the flu, et cetera. How would you correlate that to COVID, and why it's important to get the vaccine, even though it's not a guaranteed shield of armor against contracting the virus?
That's a great question. That's an entirely reasonable question a lot of people have, because you're hearing and experiencing breakthrough infections, which is where somebody who's vaccinated still gets COVID. And there's several points to make about this. Number one, the vaccine in those trials was about 95% effective at completely preventing COVID. That's amazing. By contrast, the flu vaccine is about 60% effective. However, if it's 95% effective, that means 5% of people will get a breakthrough infection. When you're vaccinating, as I said before, 6 billion people, 5% of 6 billion is a fairly large number. And so you're going to see what seems like a disproportionately large amount of breakthrough infections. It's those breakthrough infections that get a lot of attention. So it's kind of boring for a friend or the news media to report on someone who's doing great, right? Like imagine a newscaster on the lawn of Juanita Gonzalez's house who got the COVID vaccine 6 months ago, and she's doing great. And she's going to work today, just like she did every day for the last 6. That's kind of boring, right? But what's really interesting is to interview someone who had a breakthrough infection. So you're hearing those, what I would call the numerator, those smaller numbers at the top, the 5% are getting 95% of the coverage, while the 95% that are totally protected get 5% of the coverage. Another really big point is that it's 95% effective at preventing infection, but it's about 99% effective at keeping you alive. And so most people, I think, would admit they wouldn't worry so much about getting COVID as they would about dying from COVID. So yeah, if you notice, these breakthrough infections, by and large, don't die. They get sick, they live, and then resume their lives again. So this vaccine, even though there's a 1 in 20 chance you might get COVID, it's probably going to keep you alive and keep you out of the hospital. And lastly, those breakthrough infections don't shed the virus as much. They're not as contagious to others. So somebody with a breakthrough infection is less likely to infect other people, such as your family, than someone who has a real infection who's completely unvaccinated. So those 3 points, I think, are what I would emphasize with breakthrough infections.
Thank you. That is a really, really informative summary of why it's important to get the vaccine, even though you might still get COVID. I love that 5%, 95% correlation, and it all relates to what you were saying earlier about what you study in terms of what the media covers. So important to keep that media literacy in mind as well. To circle back to kids as we wrap up, if you could give us a couple of talking points. I mean, 5 to 11 is a pretty big age group, and their cognitive skills and comprehension, increases pretty dramatically over those 6 years. Maybe a couple talking points for the younger set and a couple talking points for the older set, just to like really help parents navigate those conversations in terms of telling their kids that they're about to get a vaccine.
Yeah. So I think with the younger kids, the first talking point would be just explaining what's going on because of that fear of COVID. They may be a little confused as to what's actually going on. Is mom taking me to get COVID? Is this shot going to give me COVID? I've heard so much about that. So put them at ease and explain why your younger child is going to get the shot, and point out people in the family, friends that you know that have gotten it and have done well. I think with older kids, they may get the fact that it's a shot. They may question why they need the shot for some of the reasons you brought up. Like, I heard so-and-so, Johnny, my friend, got COVID and he's fine. Half my soccer team got COVID and they're fine. I heard it's just like, cool, why am I getting this? And then you could explain that to them. Well, we don't want you to get sick and infect other people. And there are some kids that really do get sick, even though it's rare. And we don't want you to be one of those kids that happen to get really sick. And so with those older kids, explaining why we're getting the shot, with the younger kids, reassuring them about the shot.
Awesome. Thank you. And then lastly, if you could remind our listeners, our parents who are listening and watching today, why getting vaccinated is so important to a child's health. Frankly, not just regarding COVID, but vaccines in general.
The best argument I can use is I often ask parents, have you ever heard of a kid with tetanus? Have you ever seen a child with measles? Have you ever seen one of your children or friends' children get whooping cough or polio? When's the last time you saw a child in a wheelchair from polio? And most of the time they say, I've never heard of that. That's something in the history books. The reason for that is because of vaccines. Before vaccines came around, all those things were a risk. A child could die before they were a toddler of any of those infections. Vaccines probably are the single greatest public health advancement of the 20th century. And it's why our life expectancy is now a lot longer than it ever was before, and why people have never heard of those diseases. COVID is another great example, because this is the first time really in our generation that we have seen a disease that's really impacted us that we initially didn't have a vaccine for. Think how scared people were in the spring of 2020. And we didn't know what was going on. We had no way to protect ourselves other than this arcane, let's put a mask on and stay in our house, which is what they used to do in the plague outbreaks of the Middle Ages. They would hide in their hut and wouldn't let anyone in. And that's kind of what we were doing. Why are we now out and about and less afraid? Because we have a vaccine. And so there are vaccines for all of those diseases, and you can protect your child with a very safe and effective shot. And then you can rest assured the rest of your kid's childhood that they're probably going to be safe from those diseases. It's one area of your child's life as a parent that you can have strong control over.
Well, that's a solid argument if I've ever heard one. There's so much as a parent we have no control over, so might as well take it where we can get it. I just want to let listeners know that we are going to host a pediatric vaccination clinic at Carrie Tingley coming up on Saturday, November 20th for primary doses, and then Saturday, December 11th will be the secondary doses. We'll flash up a flyer here at the end of our conversation with some more information in terms of the location. You register through the state portal, and there's an event code that you can enter, which is Lobo Pups, as in puppies, but pups. And that way you can get your child vaccinated through UNM, very, trusted, wonderful source for medical care. And I just want to thank you again, Dr. Dehority, for joining us today. This has been a really wonderful and informative conversation.
My pleasure. Thank you very much for having me.
You bet.